Hi, my name's Maddy, and myself, Jonathan, Abby, and Adara will be talking to you about a cesarean birth. We will be informing you of the importance of prenatal, postpartum, and infant care, the anatomy and physiology of the procedure, the health risks, the health teachings, the assessments, and the interventions. A cesarean birth is also known as a C-section. This is when an incision is made through the mother's abdomen and uterus. This incision could be one of three. It could be a low vertical incision, a low transverse, or a classical incision. A C-section is done when the physician thinks that it is best for the health of the mother and the baby.
Rates of cesarean delivery have increased steadily worldwide during the past 3 decades. Rates have continued to increase in Canada from 18.7% in 1997 to 28.2% in 2016, representing a 15.8% increase in the past 20 years. The observed increases in cesarean delivery rates can be attributed to women giving first birth at a later age, increases in maternal obesity, use of fertility treatments, convenience for both physicians and patients, and more women being inclined to have a cesarean delivery.
So Mom, this is how your procedure is going to go for the cesarean section. We're going to get an IV inserted into you for fluids and medications, as well as a catheter so you can urinate throughout the whole process, and it's not going to be a concern. You're also going to be hooked up to monitors so we can closely take a look at your vital signs and make sure everything's running smoothly. After that, we're going to drape a curtain across your lower chest, and you and Dad will be on the other side getting ready. We are going to cut an incision 1 to 2 inches above the pubic bone, which is sometimes referred to as the bikini line for a better idea of its placement. It's usually horizontal, and you might feel some slight pressure, but you shouldn't feel any pain at this point. We're then going to move away the skin, muscle, abdominal cavity, and bladder from the uterus. So now that the skin, muscle, abdominal cavity, and bladder are moved away from the uterus, we're then going to make another incision into the uterus in the amniotic sac, and this is when doctor takes out baby. Baby's umbilical cord will be clamped and then cut. The placenta will be removed, and then doctor will suction out any remaining amniotic fluid. An assessment of baby is going to be done, and if everything is looking good, baby's looking good, healthy, skin-to-skin contact with mom is going to be initiated as soon as possible. Doctor's going to start putting everything back into place and suturing or stitching mom back up, and it's actually done from the inside out. The sutures will dissolve on their own, so you don't have to worry about getting them removed or having them fall out.
After a mother undergoes a cesarean birth, it is important for her to be aware of the activity restrictions, the diet, and the incision care needed. It is important to rest when needed, as this will promote a faster recovery period. It is important to try to walk a little bit each day. It is important not to have sexual intercourse or to drive until your doctor has stated otherwise. It is important to hold a pillow over your stomach if you need to cough or take deep breaths. And it is important that you avoid strenuous activities for at least 6 weeks after.
Very important for mom to get some exercise post C-section. Getting her blood and muscles moving is good to prevent possible blood clots. Easy exercises like going for a walk or a jog or some yoga and stretching videos are great ways for moms to prevent this from happening.
For diet, you can eat anything that's in your normal diet, but if you feel that your stomach is starting to get upset, you can try low-fat foods such as rice, toast, and yogurt. For incision care, you are to change the dressing every day. You can wash it with warm water, soapy water, and pat it dry. It is important that the area is kept clean and dry.
Some interventions to promote the healing of mom's new cesarean incision site are going to include regular assessments of the site, monitoring for any signs of infection like warm to touch, redness, tenderness, inflammation, any oozing from the incision site. We're also going to monitor mom's pulse rate. Is it increasing? Does she have a fever? What's her temperature? And what are the odor and the color of pus coming from the incision site? We also need to make sure that the incision site is only touched with freshly cleaned hands. The incision site can be cleansed with warm, mild, soapy water and then patted to dry. We need to ensure that mom is not overextending and that she's getting enough rest, because rest is important for optimal healing of the incision site and post-cesarean section.
When to contact your doctor. Tell your healthcare provider if you have any vaginal bleeding that is very heavy, like your menstrual cycle. It is light and lasts beyond 4 weeks. It involves the passing of large blood clots. Also call your healthcare provider if there's swelling in one of your legs. It will be red and warmer than the other leg. Pain in the calf, warmth, swelling, or drainage from the incision site, or your incision breaks open. Fever more than 37.8 that persists, increased pain in your belly. Discharge from your vagina that becomes heavier or develops a foul odor. Becomes very sad, depressed, or withdrawn. Are having feelings or harming yourself or your baby, or having trouble caring for yourself or your baby. A tender redness or warm area on the breast. This may be a sign of infection. Postpartum preeclampsia. While wear can occur after delivery, even if you did not have preeclampsia during your pregnancy. Call your healthcare right away if you have swelling in your hands, face, or eyes. That can be a sign of edema. Suddenly gain weight over 1 to 2 days if you gain more than 2 pounds in 1 week. Have a headache that does not go away or becomes worse. Have vision changes such as cannot see for a short time, see flashes or spots. Are sensitive to light and have blurry vision. Body pains and aches similar to back pain with a high fever.
Thank you for watching our video on cesarean section. We hope that you found it informative and learned something along the way.